My name is Rita Mukhtar. I'm a breast surgical oncologist at UCSF. I co-chair the local regional working group for the I-SPY2 trial, which is a neoadjuvant chemotherapy trial in breast cancer. And I also lead lobular breast cancer research here at UCSF. ASCO this year was super exciting. One of the themes that was really prominent was all of the new research coming out around ctDNA. So ctDNA is a type of liquid biopsy. So by doing a blood test, you can actually check to see whether there are fragments of DNA from a tumor that are floating in the blood. And there are many ongoing studies showing that having ctDNA in the blood can help predict whether or not a tumor might come back after it's been treated and can help guide the type of medical treatment that a person gets in terms of the medication or the chemotherapy or drug that they might be receiving. I presented some data from the I-SPY trial that was also using ctDNA, but we really took a different angle and looked at ctDNA and how we might use that to plan our surgery. So for patients with breast cancer, part of the surgical treatment involves removing lymph nodes. And sometimes we have to remove almost all of the lymph nodes just to see whether or not there are tumor cells in those lymph nodes. But when you remove a lot of lymph nodes, this can cause complications such as swelling of the arm. So what we found is that after chemotherapy, if the circulating tumor DNA or the ctDNA test shows that it's positive or negative, it actually seems to correlate with how many lymph nodes might have tumor. So we still need to do further testing to confirm these results, but this is really, I think, maybe the first time or one of the first times that we're seeing a direct relationship between ctDNA and the way that we plan our surgery. So at some point in the future, ctDNA might be a test that we are routinely getting before we plan the surgery that we do for breast cancer.